Hi everybody, I'm Subash. I'm a GP in North West London and also a medical school tutor here at UCL. So one of the challenges that I have as a GP is based on a daily challenge of diagnosis in an ethnically diverse population. So in London we've got 9 million of us, and incredibly the statistics suggest that a third of us were actually born, so a third of Londoners were born outside the UK. And 41% of Londoners are also from a BME background. So this is very, very interesting, because a lot of medical school training and teaching historically has always looked at examples of patients and knowledge based on your standard, what was deemed to be normal, white Caucasian population. However, practically for me, it's much more of a challenge than that, because the vast majority of patients that I see are certainly from a BME background. To give you a few practical examples, we've got a medical condition called, it's a sign called peripheral cyanosis, which is to do with a reduction in local circulation to the peripheries, and an increased usage of oxygen in the peripheries. When we're taught at medical school about it, and certainly in textbooks, we're shown something like this, which is your typical white Caucasian hand with a bluish tinge to the fingertips, and we're told, you've got to look out for these signs when you see them in patients and prepare for exams, and the practicalities when you start actually seeing patients regularly. More frequently, if I do see something like that, it'll probably be in a patient on the right side. So a lot of clinical signs and symptoms that doctors, especially working in London, will see will be for the very first time when they actually start working, which is somewhat of a concern. Another example, so melanoma is a type of skin cancer. And we've got an example on the left here, so white Caucasian patients. And again, if you do see this condition, and I've seen it on a few occasions in Afro-Caribbean patients, it's a bit more similar to the right side. There are also a whole host of investigation differences when we get sent results just very briefly, when we get sent investigation lab results from the hospitals, they'll send us reports saying, oh, these are all massively abnormal results. But what we actually know is there's a huge ethnic variation, and lots of the results are actually absolutely normal based on where a patient's from originally. Okay.
Thank you. My name is Jayne Kavanagh. I'm Lead for Ethics and Law at UCL Medical School, and I'm a sexual health clinician as well. And I've been asked to address this question: so what kind of patients do students learn from? And I'm going to do that by telling you about the Year 5 work that I do with women's stories in these topics. So this work was inspired by many women. These are 4 of them. Does anyone recognise any of these women? Kath Wolf, who's a senior lecturer of medical education, sat just at the back there. Yeah, so that's the top person there. Any others? Trish Greenhalgh, very good. Susan, Professor of Primary Care, previously at UCL, currently at Oxford. Anyone recognise the person at the side? That's Audre Lorde. Audre Lorde, yeah, very famous feminist poet and writer, who hopefully I'll have time to come to at the end. And the person on the right-hand side is Vanessa Wolfe, who is a famous London-based storyteller. So back in 1999, Trish Greenhalgh published a paper called Narrative-Based Medicine in an Evidence-Based World, where she emphasised the importance of doctors engaging with patients' stories and co-creating meaning in consulting rooms. And since then there's been plenty of research which actually shows how important narrative medicine is for learning. So it engages learners and it promotes understanding, memory and empathy. And in 2013, Kath Wolf and I, with the help of Trish, applied for a public engagement grant to run a series of events. We worked with the storyteller Vanessa Wolfe to create this Stories from the Soul series of events, where Vanessa developed and performed stories around FGM, abortion and breast cancer. And it was during this project that it really hit home to me how powerful women's stories are and how they can be used in medical education. So moving swiftly on, in year 5, these are the sessions where I bring women in to tell their stories. And so FGM, domestic violence, sexual violence, abortion, and LGBT health. And in the orange sessions here, we have facilitators who have experience of conscientious commitment to abortion care and who identify as lesbian, gay or bisexual. The purple session is a session I would like to do if anyone would give me the curriculum time to do it in. Student feedback is excellent for these sessions, so students consistently tell us how much they value hearing from women and how much they learn in these sessions. And importantly, the visitors also tell us, the women tell us, how empowering these sessions are for them and what a positive experience it is, and how worthwhile they find it coming to speak to medical students. These sessions they take a little bit of effort to set up. You need a teaching champion, you need the contacts, and you also need the support of your administrative team and also senior curriculum leads. So people like Faye Bisham here, Melissa Whitman in Year 5 have given me the time to develop this teaching and to make it the engaging and rewarding experience it is. And my time was up 2 minutes, a few seconds ago. I leave you with the words of the wonderful Audrey Lord. Thank you very much.